Going live. Okay, perfect. So we are live now. Hello, everyone. Good evening. Thank you so much for joining in us today. My name is Sunil Satyavolu, co-founder EdSense and Profile. And today we're going to talk about most happening topic. And firstly, I wanted to start off this conversation with gratitude. Firstly, to both the doctors for sparing some time while they have a lot of other things to do on a Saturday, on a Friday. But they took some time to kind of spare some time and then join us today to share their wisdom with us so that we can have some peaceful life. And above that, really grateful to God for keeping us alive, looking around the world. Many people whom we know closely, whom we have worked closely, have just disappeared. So these things keep us down, but at the same time, optimism and being grateful to God is something which is keeping us going. So on that note, I wanted to get started off, with today's topic. Very important topic in current situation. Not only because a lot of us are going through a huge stress, but primarily because the future is presented to be much more scarier. So on that context, wanted to be very, very vigilant about what we hear, what we believe, and then what we follow. Information is flowing across everybody from the WhatsApp university and Facebook university. Everybody are speculating so much, but that cannot determine our actions. So the idea is how quickly can we actually confirm whatever we know is true versus how quickly can we actually start taking action so that our kids are safe, kind of stuff, right? So thank you so much, Dr. Anthony and Dr. Rajath. Thank you so much for being so kind enough to spare some time. Welcome to the show.
Thank you.
So I'm going to quickly introduce both the speakers. Most of them are who have registered to the session. Most of them are who's watching us today are aware of both of you. But just so that we can give a better perspective to everybody who might be possibly new to this session, I'm going to introduce Dr. Antony Robert Charles is a pediatric surgeon and pediatric urologist who is currently practicing in Bengaluru. For over a decade, he has been focusing on pediatric and neonatal care as well as emergency cases concerning pediatric trauma. His specific area of interest is in neonatal surgery, pediatric urology. Dr. Antony Robert Charles has received advanced training in pediatric surgery at renowned AIIMS in Delhi, after which he practiced in St. John's Medical College in Bengaluru, where he was an associate professor, receiving his training in laparoscopy and urology at this institution. Welcome to the show, sir. Thank you so much.
Thank you.
Dr. Rajath Athreya is gold medalist in MD Pediatrics from Bangalore Medical College. He trained in the London Deanery, working at world-renowned hospital, including King's College Hospital and St. Thomas Hospital. He was a consultant neonatal University Hospital, Lewisham, and faculty with London School of Pediatrics. He is an instructor and Restoration Council of UK and neonatal stimulation trainer with the London Neonatal Transport Service. Welcome, Dr. Athreya. Thank you so much for joining in us.
Thank you. Thanks for having me.
All right. So how much we should be worried about? So I don't know who can start first, but as a parent, not just seeing as a volunteer in this space for quite some time, how much we should be worried about this so-called wave 3 or whatever is happening?
Yeah. Before we start, I'd like to also say how I know Sunil, because Sunil is a person with an infectious smile, as you can see. I encountered him last year when we did a program on integrated learning right at the beginning of this lockdown. So I think he plays an important role in this online space in the educational field. And that is also the role that I'm going to come in today as. I'm not here as a pediatric surgeon or a urologist. I wish the corona had a surgical solution. We would have just finished it in no time. Unfortunately, I'm not here as a surgeon. I'm here as a parent. I'm here as someone who cares for children. I'm in the education space. So that is what I'm going to be focusing on. Whereas Rajath, my good friend, is the subject expert on the medical aspects of this. So I think let us start with the first worry that I have as a parent, which I'm going to come in the first question. I'm going to ask Rajath myself. Is this third wave a myth, or is it something which the media is drumming up? If you can answer that, then I'll come with my perspective.
So is the operative myth, or is it drumming up, or is it the media, or all the three?
All the three.
I don't think as a species we deal with unknowns very efficiently without getting either worked up at one end of the spectrum or completely a lackadaisical approach and nothing's going to happen to us kind of approach. So I think COVID has exemplified that more than any other situation in our memory, that either we have swung to one end where we thought we have done it, we have beaten it, to doom and gloom and shutting everything down, hunkering down kind of thing. And to be fair, we have never been in this situation before, so it's difficult. And to add to all of this is what makes news is bad news. Okay, so just as you rightly said, Robert, a couple of days ago, exactly the same question from the press, and I was asked to give a statement, and I was trying to say that we may not be in such a bad situation, but that's not what what would make a headline.
Yeah.
So I think it would be foolhardy of us to think that nothing is going to happen and not prepare. So I think we need to prepare in all kind of ways that we can. I'll just take a minute and say why there should be waves, and why what are these waves, and why some speculation is there that children should be or could be or would be more affected than others. See, what happens with a new epidemic of respiratory viral infection, which coronavirus is, just like the Spanish flus and bird flus of in the not so recent past history. What happens is that it's a new virus that is infecting the population. So it keeps finding its new targets. Okay, so and it spreads quite easily because none of us are immune to it to an extent that we do not pass the infection on to the other person. We may not get very unwell, but we are still not managing to not pass it on to the next person. And then what we should remember is, with the waves, the most important thing that determines the rise of the wave is human behavior. Okay, so the virus keeps on mutating, and then it's sometimes more lucky, it becomes more infective. 99% of the time, it is actually wasting its energy, and it's not that efficient. The human behavior is something that we need to focus on, Robert. So I think that's where it becomes more challenging, in fact. As we have recently realized that we let our guards down, and the crest of the wave was too high. So there will be waves, in the sense that until a majority of the population, say, let us say 60 to 70% of the population is immune either by infection or by vaccine. And what we do not know, either by infection or vaccine, how long our immunity to the infection will last. Would we be immune for a year? Would we be immune for 6 months? Would we be immune for a bit longer? And will we be immune to all the variants that are going to come? Is hard to say. So there is going to be a wave, when probably several months down the line. And the second part, shall I come back to it later?
Yeah, come back to it later. Yeah,
so I think why children would be affected. Yeah,
considering the amount of interest we've had in today's topic, we know that it's paramount on our parents' minds is the fear that this wave will come. Coming from a practical experience of our first wave, which came last year, actually there's definitely been an increased number of children who we are seeing in the second wave. Right, we've seen that both sometimes in the severe cases which we have seen in our hospitals, and in most of them it is still mild and they do get better like the rest of the population does. So I think that is what is adding to the fear of it, whether it's exponential, whether it was less last year, more this year, and later in the year, whether it will extrapolate. My take on that, I think, is the fact that the first wave didn't hit most of the children because they were really protected. Whereas I think in the second phase, they've been a little more exposed. And the third phase, they will get more exposed, because I don't think you can keep them locked up away from school, away from playgrounds, away from their friends for too long. So we'll soon see a merger. And I'm aware of this space because a lot of parents whose children are studying in our institutions are asking, saying, should we send them to school before all our kids are vaccinated? I remember some swearing that without a vaccine, I won't send my child to school. So the reason I'm sharing this is because the fear is definitely real. It is not an imagined fear. Both of us, Rajath and I, are not here to poo-poo it by saying, oh, don't worry, it's not, we're not coming from that space at all. But we want to come to a place where we want to say what is practical and how we can go forward. And I'm going back to what Sunil said. He said both of them have come to share their wisdom. Definitely when it comes to Corona, I don't think anyone is much the wiser compared to the other. In fact, there is so much of data in the WhatsApp University and the online space that everyone has more knowledge about this than the next person down the line. And I think this is, one of the few places where as medical people, we don't know too much better than what is available out there. And that is why I think the I don't know answer is going to come quite often, at least from me. And I'm sure Rajath also is very forthright when it comes to that. So that's the space we're starting from. Sunil.
Sure. Thank you so much. So, firstly, right, I think the point is pretty clear that we don't know what's coming. All we can do is to determine our actions to be well prepared is probably the flavor that I got from both of you, if I understand it rightly, right? So for all the parents, including me and most of the parents who are on the call, and the conversation has been either vaccine or how do we protect the kids. These are the only two topics happening across. Even we schedule a meeting online for an office purpose before everybody else joins. This has been the topic all the time. So did you get vaccinated, or what happens with the kids? So how do we determine our actions at home? Because now kids are emotionally already low, and how much more can we do to keep them in control? Saying that, okay, don't do this, don't do that, wear mask, eat that, don't eat this, kind of a additional burden. How, as a parent, can anybody determine to take these actions and make sure that the kids are protected equally? And the follow-up question on the same thing is, parents are already under huge stress, so we can't expect them to be wearing a dignified hat and handle this really, really well. They're already under huge pressure. So when both the parties are under huge pressure, one knows half what is happening and another knows absolutely no idea, which are kids. So how do we deal with this actually?
Yeah. Rajat, let us go with this one before we go to the virus itself. I think apart from the corona and I think the other big impact which has happened is the one of fear and despair. The atmosphere, it is not just out there, it is there in our homes. And I see it in my own house, because as soon as the kids wake up and come to the front room, the TV is on, and the first question I'm noticing day after day is, okay, how many people died yesterday? How many cases today? How many people died yesterday? I think this is an overdose of exposure to death and despair, which no other generation has had. I don't think in the Spanish flu they had this. They would probably just wait for news to filter in a few days later. Whereas we are getting bombarded. It is definitely, as you said, it's affecting us as adults, as parents and as elders. But the impact on the child, I think that is something we should not forget, because there is a price to be paid for this. There definitely will be, and as they grow up. One is, of course, the memory of it, but two is being surrounded by so much of death and destruction, and the loss of hope. Right. So I think apart from all the other precautions that we're going to take, I'm going to talk about this later as well, but just to start it off, apart from just the disease prevention, I think we have to keep hope in front and not allow hopelessness to creep into their minds, because they trigger their emotions based on how we are at home. And if fear is pervading us, then I think it is imperative that we provide the protection for their emotional state as well. Rajat?
Yeah, I couldn't agree more, Robert. I think we'll come to some hardcore medical information that probably people are looking forward to as well. One of the things that we probably need to prepare. When I say prepare, is not just ICU beds or ventilators or, whatever. I need to stress that we need to prepare as a society and as families, as, smaller unit of that society, to battle all these kind of things, which will, my reading is that will become a huge issue in the third wave, if it is quite, this thing, because it across the socioeconomic strata, this is going to have an effect. So children are going to miss school. Some of them are there at the cusp of their, beginning a next kind of, scholastic goals, be it 10th or 12th or whatever. Then the normal resilience that one would find in kind of day-to-day interactions with kids, blowing the steam off, playing fool, the normal, whatever we have grown up with and the kids have grown up with, is missing. So how do we kind of prepare for that? I think one is to first acknowledge that it's going to be a slightly different, if not difficult time. So we need to be open-minded about it. We all will have good days and bad days. Some days I might feel withdrawn. Some days I might, throw a tantrum. Some days I might binge eat, whatever it is, we need to make slight allowances for all those things. And then I think I was not so long ago, I was listening to one of the foremost child psychiatrists in Bangalore, Professor Sheshadri, and he was talking at length about having a culture of egalitarianism and keeping the conversation open. So we should not, as Robert is saying, I will not be scared to say I don't know. So when you display that, children will not say, I'm a little bit scared, and that's a good point. I'm a little bit anxious, and then we can always bring that hope angle in, because there is it's not a hopeless situation, to be honest. Even now, only in one child for 9 adults is infected, and very, very small percentages are coming to hospitals. And yes, there will be some adverse outcomes, but on the whole, it is not going to be huge. So the fear should not kill us before anything else does. So I think we need to keep on focusing on the positive things, and that will never come from, unfortunately, any of the media that surrounds us, Robert, because it doesn't make good clickbait, so to speak. So I think as families, we need to have a few things. I have a few tips. I will wait for Robert to fill in on that. But as family, what I would say is, have a routine, and get children involved in, different chores in the household. Let them feel a bit responsible. Start a new skill. I can see friends and relatives, somebody is learning keyboard, somebody is doing something else which can be done from home. Then do things together as a family. Be very conscious about screen time, especially personal screen times, handheld devices. If you're all of you are watching some Netflix movies or something and having a nice time and discussing about it, that's a different thing. But then if you're glued to your own personal screen, then you really don't know what is happening with the other person. And then I think I would want to hear from Robert in terms of how schools are coping, how teachers are coping, and how they can help parents at home. As a parent, I'm asking you this. I'm like dreading one more year of online classes starting next week, and then I have to see my son stuck to the screen for hours and hours on end every single day. It just
I've got that. I've got that written down as a point we're going to move to. But like you said, let's cover the medical.
The medical thing.
Starting with hope. Yeah. I'm glad that both of us have addressed that in our own direction. When it comes to prevention, we've spent the whole year learning about hand washing, sanitizer, face mask, and social distancing. I don't see anything new that we're going to do with the children. Do you think that there's anything additional that we need to talk about to parents? What do you think?
Yeah, so I think we need to keep on, because we need to keep on talking about those 3 Ws or whatever people say: wear your mask, wash your hands, and watch your distance, and things like that. So we need to keep hankering on that. When it comes to how other countries have managed when they've vaccinated more people, or they've allowed children back into school, is they've started working in bubbles and clusters. So I don't know how practical it is, but we could always try. So they do smaller classes, they do set number of people are always together. So if and then you might realize that ICMR has now approved a home test kit. Okay, so at least in the UK, people have that on hand. Suppose there is some concern at school, so everybody gets screened, and then they don't lose out much time. If people have to be off school or off confined spaces or things, they might have to do it for a few days at a time and then regather. So this requires a lot of planning, and that is going to come only further down the line. I would want to also address the thing about vaccination. Okay, so what can we do practically? What can we do? See, children are not miniature adults. Okay, so most of the vaccination which has now been allowed or being trialed is happening in early teens, 12 years and above. So they more or less behave like adults. Okay, in medically, psychologically not, but yes, medically. But much younger children probably have a much more robust immune system. So the way they would react to a vaccine, be it the fever and soreness you feel in the arm, or what dose of vaccine will be effective, whether the immune system is going to go a little bit overboard. And there have been vaccines which did not work very well in very young children. In fact, when they for example, dengue vaccine, when children vaccines were trialed on children, the actual infection became much worse in some situations. So we actually don't know. So we'll have to wait. And how long is that wait going to be? We'll have to watch. So it will not be months and months until we have accessibility, because vaccine safety, Robert, I'm sure you'll agree, is paramount. Okay, just we do not want to throw the baby out with the bathwater, because children need lots of vaccines which are life-saving, be it polio or diphtheria or tetanus or whatever. And if any kind of safety issues creep in with one vaccination, we have always seen that the vaccine uptake dramatically drops. People will go off other vaccinations. So I think the whole scientific community is seized of the fact, and then vaccines are going to take some time. So practically what we can do is remove vaccine hesitancy amongst young adults. So as of now, who is in the proximity of kids, at least for the next few months, is people like you and me, parents, older relatives. And so let's all get vaccinated as and when the vaccines become available, so that we actually are not the route of transmission as much as we can possibly be to the kids at home. Okay. So that is one thing which we can practically do. Okay. Robert, come in.
We've seen pictures, we've seen videos, and we've seen people that we know suffering from breathing difficulty, right? That's how most adults are being affected. For me, I'm sure many parents are worried about how will my child react if he gets the virus, or if he or she gets the virus, because I cannot even imagine that we can see children going through that. So I want to come from that space. Correct. So children are behaving a lot differently from adults. We've seen that right from the first wave, right? So breathing difficulties is one of the symptoms, but it's not the most common of them all. So it's probably about 50% of the one. A lot of them end up with features suggestive of the tummy infections. A lot of them have infections in the tummy, whether it is a diarrhea, loose motion, whether it's actual what we call as the inflammatory syndrome, systemic inflammatory syndrome, wherein they get features. I have had babies who come purely looking with tummy pain, looking like an appendicitis, or looking like some other infection in the tummy, looking like an infection in any other part of the body. So they are going to be a whole new game when it comes to diagnosing even, because even before Corona, children were prone to so many viral infections. We were just used to children getting running nose, viral sore throat, rhinitis 4 to 5 times a year anyway. So, but here this disease is going to confuse that presentation, both for parents and for doctors. And I think we should be, as clinicians, we are aware that they can present like this, but I think even parents need to be sensitized. So let's spend a little time.
Yeah, so that's a very good thing to pass on, message to pass on to parents who are listening to us. So two things we need to remember, which are very different from what we see in adults. Okay, so overall, reassuringly, children, even if they're affected in very large numbers, a very, very large proportion of them do not become very sick. Okay, for example, if I have to put a number on it, 1 in 6 of us adults who get COVID will feel very ill or need some more medical home than just, whatever. So 1 in 6. So 5 others will not do in adults. Okay, it's still a small number. In children, what we are seeing, it's probably 1/10 or 1/100th even. Okay, so very, very small. So 1 in 60 children who are infected, or 1 in 100 children who are infected might need a very high level of medical attention. So that is the baseline you're starting. I don't think that will change humongously with the next wave, but we might have more numbers of children because they're not going to be vaccinated. So two things which are important is, when I speak to relatives of friends who have got infected with COVID, and I just ask them to be extremely careful in the second week of illness. This is as far as adults are concerned. So in children, you need to remember two slightly different time frames. One is the first few days itself, because I said children actually have a very robust immune system. So the body starts boxing the virus much more vigorously. So they get very high fevers. They get, as Dr. Robert was saying, tummy pains, vomiting, diarrhea. They might feel very tired, and they have less reserves than older children. They might need medical attention. So we do see that the first few days itself can be quite rough in a very, very tiny proportion of children. So that's why when I give online consults, I usually catch up with them on the 3rd day. So if I've consulted them today, 2 days from now, I touch base with them again and I give them danger signs. So this is what we need to be watching for, very poor activity, not taking feeds if it's a very young baby, very high fevers, difficult to control, change in behavior, blue lips and, fingers, feeling extremely drowsy, or completely crying with a tummy pain, which doesn't go away as well. These kind of things. So this is one. So very clearly, what I've told you is, as a baseline, you don't need to worry too much, but you need to watch for 2 different time frames. One is very early. Then what we are seeing a couple of weeks after the child has been exposed to COVID and had a very mild infection or nothing at all, we are seeing what Dr. Robert mentioned is multi-system inflammatory syndrome. It's a bit of a mouthful, but it is just that when the body did not have any more enemies to fight, the soldiers are getting too excited. It's a bit like our riot police. There was a riot going on, and then all the police went on with their lathis and pistols and other ththings, and most of the crowd had dispersed, and
there's no one to beat. There's no one to beat.
And then you just start. The body is just on an overdrive, and then what we call as a bystander injury. So the system is still in inflammation. The chemicals which are meant to fight the enemy are still, they get switched back on. So this is a late complicated, very small proportion. Okay, extremely small proportion. So you need to watch for recurrence of high fever, tummy pains, bloodshot eyes, okay, red eyes, and aches and pains, which are this thing, and a rash which can come and go away. So recurrence of fevers, the fever which had gone away, child was very well, came back, child is very irritable, has a lot of redness in the eyes, rashes all over the body, and probably tummy pains, joint pains, and things like that. And you please come to immediate medical attention, because this condition is easily diagnosable. And as of now, the treatment is quite straightforward, and we are seeing good response when this is caught earlier.
Yeah. And one of the earliest things that parents can look out for is a very fast breathing, especially when the child is asleep. When the child is asleep, if you find that the child is breathing a little fast, that's the best, because when they're running and active, we are not able to really gauge, is it because they're active? But if you are worried, is to look at that. And we are coming from also a space of where I've seen in our hospital in Rainbow, children coming with bad lungs, where they've come in with very bad lungs, where they've needed prolonged support. And again, there it is the immune system which is making it more difficult. So most of the treatment, as Rajath is stressing, is supportive. It is identifying and supporting the child through that immune crisis period where the system is overreacting. And I hope we don't see the mad rush for exotic tablets and injections, which we've seen with the second wave, where people are running around looking for that one magic injection and then finding that that's not really the key. The key is good early diagnosis, good supportive care early on. And I think your pediatricians across the country, the number of sessions that they're having in our own circles, they're all gearing up and preparing for it. So that I'm sure your local pediatrician would be the go-to person for the slightest doubt that you have. Yeah,
so exactly, Robert. I would just like to stress upon that again, because a lot of questions that you guys have uploaded on Google Docs is about how do I boost the immunity?
Yeah.
What food do I eat? What supplements? In fact, what we are trying to say is, especially in children, a large proportion is actually, if at all they're coming to any kind of difficult situation with COVID, it's the very robust and overactive immune system. I'm not saying we'll drive the immune system down, but if you carefully think about what some of the medications we are using, like steroids and immunoglobulins and things, we are actually tempering or calming down the immune system. The immune system has got so much excited.
Yeah.
So there is no one portion, one legume or one citrus fruit or one zinc supplement, one multivitamin supplement. Immune system is extremely robust, okay, and it has evolved in our species over millennia. So it is capable of doing what it, unless you have been on some specific diet and child is malnourished, like we used to see that horrid images from Africa where, malnourished and not eaten a meal for weeks and months, then the chemicals that are required in the body are not there. But otherwise, we all of us have good immune systems. If you come to a category where your child's immune system is to be worried, you would already know about it. Children who are on treatment for medical conditions like cancers and other very complicated, those parents are already aware. For the general public, the message is your child's immune system is extremely robust. So a healthy night's sleep, good activity, happy environment, a balanced diet of fruit, vegetables, water and things like that is all that is required. Okay, everything else which is there out in the market is to make money for someone else. So if you are so generous that you want to support livelihoods of people who have celebrity status and poor thing, they will go hungry, please go and buy into all those remedies. So whatever you would have done typically, but not making a light of the point, but sleep, rest, some kind of physical activity are supposed to be very productive. The only supplement I would probably think of is vitamin D, Robert, because if the best way to get that is to go out in the sun for 10-15 minutes when the sun
which is not available to us now like it was.
So it may not be available to you. So if that is the case, please ask your pediatrician to prescribe a specific dose. And unfortunately, like everything else in our country, a lot of different doses formulation comes. What your child might need is a 400 units of vitamin D every day. And what you might get dispensed is 60,000 international units. And we have seen that somebody has been consuming that for weeks and weeks and they're landing up in trouble.
And it can cause trouble, isn't it? Most of
these can cause trouble.
Even
so please be in the same loop.
Yeah.
And then as an appeal to this thing, please do not ask your doctors to keep on prescribing. The easiest thing for me to use a pen and write a few things. It takes a lot of effort for us to convince you not to prescribe. So please take my words. Take my word for it rather. If there is anything that your child specifically need, we will actually tell you. Okay. And some children do need some specific medications, we'll tell you. So no specific diet. Your child's immune system is good and it's really good. Okay. You guys make sure you don't bring in infections as far as possible. So you are the guys who are going out, you wear your mask, you wash your hands, you get vaccinated. Okay, give back some bit of childhood that your child actually needs at this point of time. Keep them safe. Healthy habits, immune system is good to go. Okay, and what to recognize, what danger signs, and seek medical help. So you have to keep it very simple. Any other medical things, Robert? We need to get it off the,
so I think going with your last point, I think to be alert for those danger signs, and the danger signs are actually so varied. They are so varied. It's not one sign that you're looking for. So if you think the child is off, if you know you've come in contact, if you know that in your building or in your community you'll keep an extra alert thing on, but without driving fear into the child's mind.
So because we had a spread of in the Google document, spread of age groups of people who have logged in, children's age group rather. So very young babies, they give us less clues. So what you need to watch for newborn babies and a few months, let's say up to 6 months, 8 months, all they do is sleep, wake up, cry, look around, feed. Okay, and apart from getting a fever, the first 4 things might be getting affected. The child may be very irritable, not sleeping or feeding, or might on the other hand become extremely drowsy and not feed, and they might start throwing up or have really loose stools, and they become very listless or lethargic or very tired, or they might have high fever. So this is the very young population. The older children are much easier. So I've already covered what to look for in the early part of the illness and later part of the illness. Any breathing difficulty?
If I go even younger, let's say there are mothers now. We are seeing a lot of pregnant ladies who are positive, who are coming in giving birth. So there was concern initially on as to whether can they breastfeed the baby, can they handle the baby as before. So there are questions like that which are there. I think the consensus is that with precautions they can still go ahead, isn't it?
Absolutely. So 2 very important messages. So now the government also has approved vaccine for lactating mothers, breastfeeding mothers. We are pushing for approving it for pregnant women as well. So I think the latest stand from the government is you explain the risks and benefits, and if the pregnant women want to get vaccinated, you do get vaccinated. So vaccination is important because some women in the later part of the pregnancy are getting into trouble, 7-8 months of pregnancy, and we can breastfeed. So please talk to your doctor what minimum precautions you need to take while breastfeeding your baby. If suppose you are COVID positive or there is COVID in your household. In fact, you should be probably breastfeeding because you will be making some antibodies which actually goes into the mother's milk and then via mother's milk will reach the baby. So it is nearly impossible to not expose the baby to the virus unless you completely separate them, and we don't want to do it unless one of them is incapacitated completely.
Sunil, you want to come in with some perspective?
Yep. Few thoughts while I listening to both of you, and I'm kind of flabbergasted with the alignment all 3 of us have. I wrote some notes here to ask, and you actually addressed all of them. So super surprised. So one question is, how do we differentiate between symptoms? The regular symptom to this one for parents who specifically are confused. So I thought it's a regular cold. Now I'm kind of surprised kind of stuff. So that is one thing which I request either of you to address. And building immunity is something that you already mentioned. And kids who fall sick, how risky is it for them if we do not determine our actions earlier? So is it like life risking kind of a delay would it cause or something like that? These 2 things, if you could address.
Okay, I'll take your third question first, and I think Rajath will go to your first question easily. So we are not saying that there is no danger at all, especially when it comes to the upper respiratory and the lung infection, the children who have that. There, I think it really will be important to recognize it early, right? So the risk of not looking at it would be quite high to pay. Therefore, in this atmosphere of the pandemic of corona, even if it is a normal cold, what we would have for 4 to 5 episodes, you would keep your antenna sharp. You would keep your antenna sharp. Are there specific symptoms for corona which is not there before? Not really. It is going to present like how it used to present before. And in fact, we are already doing this. If I have to just backtrack a bit, before the corona period, when there's a newborn baby or a 6-month-old baby or a 1-year-old baby who has a urine infection, there is no other way of knowing. They're not like you and me or an older child who will specifically complain that I have this problem. And very few of them used to have fever. So how would we explain to parents? We would say, if your child is less active, or you find a child is more active, you find a child is feeding less, or if you find that he's very irritable, or he is not at all irritable, he's too quiet. Basically, a change in your child's behavior, which is what you are tuned to. You are tuned to your baby. So if there is something off with that tuning, especially with the pandemic thing, get in touch with your pediatrician, get in touch with someone, raise your concern. It's easier to raise and then be told, no, it's fine, rather than to live with the worry which you're saying. Rajath?
Yeah, I would completely agree. So especially with the onslaught of the second wave,
Yeah.
So any doubt, we are keeping them under a close follow-up remotely by online consultation or something, and probably erring on the side of testing during the course of illness. So do not ignore, because as you were saying, so there are some determinants which will matter if they do not come to medical attention in the right time. So I think we need to do that. I must also stress that do not think that my child always had cough, cold, allergy. Every May or June, this is what happened to him. This is not every May or June. Okay, you ask your doctor. Best would be the pediatrician who is easily accessible to you or who looks after you and your family regularly. So please touch base with them, and then they will probably be able to reassure you, saying that this is nothing but watch out for 1, 2, 3, 4, 5, and give me a ring, or post a message to me if these things happen. So that might be all that is required. So you please come to medical attention at the slightest of the doubt. Okay, so that I cannot stress enough, actually.
Yeah.
So please do that.
One additional worry I have, Sunil, before you go to your next question, is I have relatives who are positive, who are admitted in hospital now. Most of their torture, most of their panic and pain is because they are alone in that hospital. They are in isolation in their hospital with nobody being able to go in and out. Okay, they're able to manage that. I can't foresee that for children. Right? We are not going to have, even with all the infrastructure being put in, you cannot have isolation for children. So mentally and medically, we need to be able to prepare for that, where if a child turns positive and needs to be in hospital, we know that they will not be alone. So we'll have to factor that also in. So the parent being there, the caregiver being there, and that caregiver coming back to the other children in the family. I don't have an answer for this. I'm throwing this out there because I think there are things that we need to at least talk about, and then the solution probably will come. But this is my big fear, because I don't think you can enforce what we used for the first and second wave for adults, for children in the same breath.
I think that's a perfect segue for what I wanted to add as my point, to the point where we said, obviously we cannot control the situation, but the only control that we could do, because adults are the carriers towards kids.
Yeah.
And you being careful is some important element. At the same time, you cannot be in the hospital could be a situation also. So how much more careful can you be, or you should be, in making sure that the kid is not infected? And I also heard scenarios where the parent is affected, kid becomes the carrier, and he spreads it across to everybody else in the house, because the parent gave samples and waiting for the results to come. 3 days, there is no results because the samples were piling up. In 3 days, whatever damage is supposed to happen is already been done, kind of stuff. So I think this is more to do with the determining parents' action than staying safe, taking all the precautions, not trying to be heroic, than actually trying to put more stress on the children medically and also emotionally, because once they get affected, we really can't explain to them, because adults are finding it difficult to accept it. So kids cannot definitely accept it. So can't agree more on that aspect. Some extremely optimistic question, is it safe to send kids to schools?
We've been debating this from last year, because I'm also part, like I said. So we were actually hoping that schools would open sometime in June, July this year. I think most offices were planning that as well. And the big thing is that fear among parents and amongst educationists is still very, very high. Okay, so even if they're going to pick it up, I think part of the answer comes from what you just said, Sunil, where you said that that child would have spread it to others before the report came. I think in a way that's probably what would be the right thing to happen. Let me qualify that, because I think, like Rajat started off the whole meeting with saying that such a small number of them will get affected badly, and majority will get it, get their antibodies and move on. I think that is probably what is going to be the solution in the long run, because they're not going to get their vaccines in time. And should we put off schools and colleges till every child is vaccinated? You're probably looking at 5 to 6 years more of lag time before even all our adults get their vaccination. So that is not a possibility. So do schools need to reopen? I think so, but not at this point. Let us see. I think my personal opinion, what I'm discussing, is the time frame for this third wave is a few more months away. And looking at, we are only learning from the Spanish flu time, where the wave came at that point in time, and it's a smaller wave. I think we'll have to wait for that wave to go before we can think of school. And school is going to come, as Rajat mentioned, like in the UK, what they're trying in terms of different time slots, less crowding. But ours is a different country, because I cannot imagine that that's possible even in the government school setup or in the middle segment school, where the numbers are still huge. The numbers are still huge. The transport system is going to break down if we get it into this divided things. What if the fears which parents ask me is, what if one student gets it? Does my child need to be exposed to it all? And I think the answer to that will come actually with herd immunity. It will come with herd immunity. The more people get infected, low grade, get their antibodies and move on. Rajat?
Yeah, so one of the things we need to probably think of is, what is safety for all of us? We have now a very heightened sense of perception of threat. Okay, so it's very difficult to take that away. So schools need to be reassured themselves. They need to be reassuring to parents, and then there will be blips. There will be children who will get infected, even whenever the people are vaccinated also. So what is the thing? So one of the things we hear is, no one is safe until everyone is safe. But are we going to wait till that point? The way I would see that statement is, make sure that you keep people safe. You are having to go and work or go to school and something like that. So there will be things that we can do. One thing I was thinking, Robert, I don't know, in your school education circles, what they would feel is 12 years and above, I think we will have vaccines coming in quite soon, maybe 3 months, 4 months, 5 months from now, because US is vaccinating. Yeah. 12 years and above. So suppose by any kind of stretch of imagination, we will be able to start doing it, like, let's say 6 months from now. For older children, maybe those kids will probably start coming into school campuses. Yeah. And then that will at least get the system rolling, and it will test the systems. And then we can think of, getting other children into school as well.
Correct. And I think that is probably a jolt to the education system, which needed to be given. I think we've gone to a phase where we went through decades of trying to push children earlier and earlier and earlier into schools and preschools and preschools and everything. But I think schools will probably start in the retrograde fashion now. They'll start with the older children, like he said, with the adolescents, and then probably the high school, then the middle school. And the trouble is going to come in keeping the smallest children at home, because those are almost like daycare centers. And that is, on one hand, it is very good for the child emotionally, but I think for parents who are already stressed out with their work from home schedules or their difficulties, because those children will be the last to join the school bandwagon. They will be the last to join the school bandwagon. And I have teenagers who are at the cusp of their career changes, where everything is put on hold. And I find one of the biggest challenges is motivating them to still have a routine of study, a routine of, it is impossible. And with teenagers, we can't argue, because the question they throw back at us is, what do you want me to study for? There's no exam. I went through my 10th without an exam. I passed my 11th without an exam. Most likely there won't be an exam for 12th. And I think that is, it's a practical question, and which we don't have answers to. And I think this is where I'm hoping, and I'm going to try to push, is that the school entire education system, our syllabus writing, our board system, I think everything needs an overhaul. And actually this corona pandemic has given us an opportunity to control alt delete, to restart the entire paradigm and to move on to the next paradigm. We can do that as another session, Sunil, sometime later.
Yeah. Sunil, can I just interject?
Sure.
Just after 5 o'clock, I need to join another Zoom call.
Sure.
Not just us as parents, you would be very happy to know the state government here is also preparing for the third wave. So they have invited me as an expert on that panel.
Sure.
So in another 10-15 minutes, I might have to take leave. So if there are questions,
let's take the medical questions.
So if there are questions, then I think if you list them out, I will tackle them one by one.
Sure.
Because those things should not be left hanging in the air.
Definitely. So the question is there any specific age group which is at high risk? That's the first question. And second question, the newborn baby or kind of infants getting affected and mother is getting affected and they recover, what to expect post recovery? That is another thing which is thrown. And new mommy care, I think you covered it extensively, to be careful. And a lot of questions around building immunity. I don't know, maybe we'll end up being forced to answer something. You already mentioned their immunity is already stronger. There is nothing to be done. But like you mentioned, forced prescription kind of a stuff. I don't know if there is something to be done. But these are 4 questions which are asked. I'm kind of scrolling down for other questions while you answer these.
Yeah. So specific age group, we would always worry about extremes of age. See, very young babies, mainly because it's very hard to pick up symptoms. They keep you fooled for quite some time. So you might, regularly have a baby who's crying all night, and suddenly this might be one of the nights. So you need to know the pulse of your baby and then see. So very young age group is quite difficult to pick up signs on. So they might need to be, you might need to keep on pestering your pediatrician for an opinion, if at all this is something to worry about or not. There are other specific group of children who we thought were high risk. For example, children with breathing difficulties and asthma. So even in the second wave, those children actually have done quite well. They've not come into much harm. Okay, so you need to, but they're the ones that potentially can need medical attention sooner. So if your child has a medical condition that needs specific treatment and visits to hospital, be it any condition, I think you need to a little bit more alert. Then what we're seeing is children with higher body mass index. So children who are overweight, which is not very uncommon at all. So obesity pandemic is probably as booming, or if not more booming than coronavirus, and we have completely ignored it, although it is quite obvious by its size. But so children who are overweight, who are physically not very active, they also have needed intensive care and things like that. So every other medical group, I think your doctor will keep you posted, so you don't need to worry. You have very young children and children who are overweight and who have medical conditions. Newborn baby, I think I've covered. So that's just it. Post recovery also I've covered, Sunil, because I think we need to watch for this inflammation condition in children, which can come in as late as a month after they have had infection, as early as 2 to 3 weeks. And this is something which might change slightly with the variants coming in. We might see more of this, less of this, slightly less aggressive presentation. So we have to be on our toes about these kind of things. Building immunity, I'll take 2 minutes to explain what immunity actually means. So your immune system has evolved. Okay, so when you're born with what the nature has given you. So basically, if you have an intruder, so there is something called as innate immunity, right? So even without a specific intruder coming in, it is like the main door of your house. Okay, is it going to stop any intruder from coming in? Yes. So we are all born with it. So whatever we have, it might be our nasal passages trying to kill the viruses, to our cough reflex. There are a lot of things. There is something called as innate immunity. So that actually is there. What we need to worry about is that when the intruder comes past your front door, okay, because they are pathogens, they will somehow wriggle in. Is at that point, do you know to recognize that person as an intruder, and do you have the right tools to fend him off? So that is what is worrying, and that's where vaccines come in. Okay, so there is no way that you can buy baseball bats or hockey sticks or licensed weapons to fight off. So if you're looking at immunity boosting things, you have everything, but you might have ability to recognize the intruder. Okay, that ability either comes from a natural infection. So you have seen, this guy is a rogue, I've seen him before and he did all this mischief, so I'm not going to let him stay in my living room for much longer, we'll kick him out. So that's what immune system should do. The other way is vaccine. So vaccine will train you. So vaccination is a school that your immune system goes to, and it will be shown pictures of all these rogues, the roll call, most wanted kind of thing.
Rowdy sheeters in the police station.
Rowdy sheeter, yeah. So Robert knows this somehow. So you need to train. So vaccines train. So it's all about identifying. So there is nothing wrong with your immune system, except that it might have trouble identifying the intruder. Okay. So for that, you don't need to build in a armory. So there is nothing, and there is nothing like that, to be honest. Yes, ginger, tulsi, honey, lemon, all these things have really good things in it. Okay. Which might keep you a little bit on the healthier side. But there is nothing, we have had people going into liver failures consuming giloy juice, for example. Have you heard about giloy juice? Now everyone has heard about giloy juice. Robert hasn't heard. Okay, so it's a polyherbal product, I think from noni fruit or something. It's supposed to kill corona, if you're not realized. But people have gone into liver failure because there is a very small proportion of people who, it's a poison for some of us. It's not. So my really strong advice would be, you do not have to rush into, arm yourself with anything. You have
quite a few of these roaming around. I had a patient of mine who walked in with a whole strip of concentrated turmeric, which has been put into this condensed tablet form, and they were asking, can I give this twice a day to prevent corona? Oh, I don't know where that's going to go in the long run. So I
must also warn against things that have been going around in terms of medical advice, in terms of steaming and other things. So we do a lot of young children come with burns and scars from steam. Okay, so if you're doing anything for comfort, if your cough gets soothed by taking a bit of honey and ginger in your tea, please do it. If you feel that you took a little bit of steam and you feel relieved but this is not going to keep the COVID away or treat the infections. Yeah. Okay, so immunity is a very robust thing, and it's very much there with all of you, unless you're on treatment for something like cancer or things like that, which most of us are not. So you need to remember that the only thing that needs to happen is your immune system needs to recognize the intruder, and that will happen with vaccination, and that will happen with herd immunity, because 70% of your building knows that this is an intruder. That is herd immunity, right? And they'll not let him get past the main gate of the apartment complex. So you warded him off. So herd immunity works like that. Vaccines work like that. They will know who is on the rowdy sheeter. And then if you get mild infection, you yourself will know. So
it's almost like a vaccination, isn't it? If you get a mild infection, it's almost like getting one.
Yeah, it is probably more effective than the vaccine in some instances.
Yeah.
Yes.
And let's not forget that in the first and the second wave, the majority of people who recovered right? Well, yes, we're all focusing on the ones who lost the battle, but still the majority recovered without the vaccination, which means your immune system had the wherewithal to actually identify and put it off in 90% of the cases. So that, I think, is the good news about the immune system for us.
Anything else, Sunil? Because in 5 minutes I'll sign off.
Yeah. So I think most of the questions which are specific to the agenda today have been answered. Other questions are about well-being, how to engage kids and all that stuff. I think probably in the interest of time and also demand, we'll probably have another session. But I think to do with immunity, to do with being careful about all that recovered parents, how do we take that? Can parents be a carrier and then pass it on to the child and child spread it to everybody else? Kind of all those questions, I think predominantly we've covered. Any last conclusion?
We can still jog for a little while if there are more questions which you pick up. So Rajath, I think anything else, Rajath, or a closing statement? Rajath is a very optimistic doctor. He's one of the most optimistic people that I have met.
Awesome.
Yeah. So, and that is the reason why he's good with children. Yeah. So that's
optimism
why
should come with caution.
Give us a closing.
Yeah. So I think what you need to know in life is what you need to be worried about. You understand the danger signs of the illness and you pick them up and then, seek help. Other than that, there's no, there is nothing else. There's nothing else at this point we can do, especially with children. So know what the danger signs are, know when to worry and when not to worry. And if you're in doubt, you need to worry or not, ask somebody who will be able to either reassure you or take some action. So that is usually a pediatrician. So that I was going to say. Other than that, I think one other thing I should mention is that somehow I think hopefully Robert will pick up on this, is both mental and physical agility. So I think we need to start focusing on some physical activity for kids. So maybe Sunil can pitch in, and Robert, I hope you get to discuss that, because I think that will make a huge difference, is what I feel. So from a medical perspective, be vigilant, know what to worry about, and worry only if those things happen. All right, I'll sign off here.
Great. Thank you, Rajath.
Pleasure.
Thank you so much, Dr. Rajath. It's an honor hosting you today, and I'm sure most of the parents feel much better after listening to you, and we'll possibly have another opportunity to kind of have a detailed discussion as well if needed. Thank you so much for your time. I appreciate it.
Thank you, Rajath.
Have a good evening. Bye, Ron.
Bye. Okay. The other thing Sunil wanted to stress on is that with so much of focus on corona, one must not forget that the other diseases which affect children are still very, very much around. Yeah, are still very much around. And they've been equally life-threatening diseases which are much higher mortality, which means we lost children before, and that is still around us. But the fear of coming to a hospital, because I know, because a lot of my patients are doing video consults, and so the fear of getting to a big hospital is justified, and it is real. We need to find a way around it. We need to find a way around it so that doesn't fall off the radar of people. Yeah, I know children who are needing dialysis, children who are needing surgeries, children who are needing other interventions. Because we need, I think, as a society also, we need to be able to find, at least for the next 6 months or a year, isolate facilities which will take care of that problem.
Correct.
And then isolate the ones which are here. I think government is already moving towards it. They want to identify non-hospital vaccination centers, because right now we are crowding hospitals with the long queues of people looking for vaccines. So I think as a society, we need to be able to demarcate that, and that we can all put a collective push. Today with social media, the more people push for something or keep asking for it, I think somewhere the voice will be heard. So not to forget the other illnesses which are coming. Yeah. So any other question?
Yeah. Another thing is, I don't know. Maybe I know the answer, but I can't answer it. So can we get the current vaccination to my 17-year-old child?
Yeah, I think as of now, the system, the app will not allow you to, even if you're having access to vaccines somehow through connections, if you have it, the app is not going to give you the certificate. Okay, whereas in a few months, if he's already 17 or 16 and a half pushing there, they will reach to that zone. Yeah, and more vaccines are coming in. We know that availability this week is far better than what it was 2 weeks ago, and I think it will ease up in time. And the government will definitely open it up, because you not only want the vaccine for protection, but I think you also need it for documentation. Soon, whether it is travel, whether it is even work, it might be a requirement to have that. So especially for your adolescent children, better to do it the straight and narrow way, which is to wait for the government to get us the permission and then do it, so that there is also documentation. I know there are friends of mine who got it done for the younger children, but they're not able to document it. And then you probably have to go through the whole process again. So it's a very gray question. Yeah. So wait for the government, and then it will open up.
Sure. And one another question, I think it's more to do with the parents. We all know the importance of wearing mask and all that, especially when they want to play out, go to the play area or meet their friends in the house. We know the environment might be protective, but still they cannot get away with not wearing masks and not using the sanitizer. So how do we tell them in a way that they understand? I think it's more like a parenting question.
Yeah, but I think it is by example. That is the first thing. The first thing is by example, because if I am doing it every time that I'm entering the house, that I'm going outside, if I am doing it innately and verbalizing it, especially for the youngest ones, they watch and they also listen, and both of them have to be in synchrony for us. Yeah, both of them have to be in synchrony. I remember going off Corona topic. I remember when my daughter, I was teaching her how to climb up the stairs when she was very, very young. I was teaching her how to do it, and she was falling. So I kept telling her to hold the railing, and I was walking on the other side. Halfway, she stopped and she said, "Why are you not holding the railing?" All right. So and I couldn't explain to her that I didn't need to hold the railing. So there was a big dichotomy between what I was saying and what I was doing. And that's a practical thing. I think most parents will go through this. So to come back, I think whether it's wearing the mask, the correct way to take off the mask, it's not just bringing the mask in and keeping it wherever the child wants to, because then you're defeating the purpose. To have, like in our culture, how we leave our slippers just near the door or outside the door, even the masks need to have a segregated area for that. You do it and repeat it to the child again and again without bringing fear into the equation, because we don't want them so paranoid that I don't want to go and play or I don't want to go out, which brings us back to what Rajath left us on in terms of physical well-being. I think physical well-being has suffered definitely, and we can't blame the children for that. We cannot blame ourselves for that. The pandemic has brought that. But slowly, in a graded fashion, we will have to go back to doing that in a safe environment. How are we going to do it? Are we going with our children for the time that they are out and doing a bit of a run or a walk or whatever? I think that will have to be there. And when a bigger responsibility will come when school starts. School will start. When school starts, the teachers and the schools will have to build this into that, so that, because as you mentioned, the part of the learning for us as we're growing up in school is the ability to fall, to be pushed, to push somebody, get up, fight, and make up, which is what team play is, which we need as a life skill, which is getting lost, because the only interaction I'm seeing from my own children is when they're doing their games with their other friends on a virtual thing. And therefore, the amount of screen time, as difficult as it is to curtail, I think we'll have to do it. And all I can guarantee is that there'll be more fights between parents and teenagers at home when it comes to monitoring screen time.
And one another question is, if the parent is vaccinated, can we loosen the rules within the house? I think, can we be a little relaxed if I'm vaccinated, because I might possibly be protected, therefore I can be relaxed at home, kind of a question. So
yeah, so at home, I'm sure, I don't know what is the relaxation. Outside the home, you are not going to be relaxed. Even if you've had both shots of the vaccine, let's start with that. Yeah. You are still not going to be relaxed. You are still going to continue your sanitizing, because we know that there are many people who have had both the doses and they have still got the disease. But the good thing is that the disease response, which we're launching, and the outcome is much better off if you are vaccinated. So having the vaccine is not a protection of, okay, I'm not going to get COVID. Okay, so when we have that understanding, so even at home, I'm still going to be careful to an extent for two reasons. One is, yes, even though I may be in the house, there are others coming into the house and going out and leaving stuff around. And two, for my child's sake. My child is going to see me being not careful, and they will emulate that behavior. So for that reason, visibly, it's better off if we continue to have the careful attitude for a few more months till the worst is over. Till the worst is over.
I think another, this is personally my question, and I think it's a question everybody should ask themselves, is considering the doctor to patient ratio. I don't know what exactly it is, but more than pandemic, more than corona, I think the panic is something which is putting a lot of stress on doctors. Yes. So Dr. Athreya definitely gave some tips on, please only worry if you find these symptoms, otherwise please don't, kind of stuff. Any words to parents on that, not to kind of barge into doctors for everything and anything? Obviously they should be cautious about it, so that somebody who's in dire need can actually get access to the same doctor, and the doctor can actually help them. So any comment on that?
Yeah, so it's a catch-22 situation. Yeah. So on the one hand, it's a disease we don't understand. Even your doctor, even your nurses, none of them have seen this before to this degree. So it is it has confused and bamboozled physicians all over the world. You're seeing the best systems in the world collapsing under the weight of this. Yeah. And I think the system in India also has coped pretty well considering the challenges. So I'm not going to say don't approach your doctor if you have a doubt. Please keep that at the priority, because that is really important. All I would ask is recognize that the nurses and the other healthcare workers and the doctors are also going through a terrible time, like you said. The rates of people who have died from our professions are high. And seek advice. Follow the advice, but don't be so panicky that you, like you said, you keep coming back with the same bug. You may not be able to give the thing. And of course, the simple things. I know parents where we still see them where they take off their mask to speak to us. Right. So then and I think that is one of the big changes which needs to happen until we have crossed the. It's like saying there's a fire in the building. Don't carry that petrol can in your hand. Don't. It's as simple as that. Don't carry it. So we know that this is the situation. Stay vigilant. When you're vigilant, your child is vigilant. And I'm glad that some children, I had an 11-year-old the other day who reprimanded both his parents because they were putting their mask up to here and he had it on and said, Dad, you told me to wear the mask, why are you not wearing it? So example and the simple things. And even if you're vaccinated, continue to be safe. Continue to be safe.
So to everybody else who might possibly be thinking my question is not taken, so we've got over 800 registrations, and most of the people have kind of asked their questions, and we've kind of summarized. There's a lot of background work that went into place because it's hard to get doctor's time at this point of time. So we managed to categorize these questions on a large spectrum, and we made sure they are answered. Some questions which are like, my kid is watching too much TV. My kid does not eat food. These are the questions, possibly regular questions. The agenda is entirely different. So apart from questions like that, everything else with regards to the corona waves have been addressed. And if at all any parent who's watching us believe that their question is not answered, please feel free to drop me an email. I was the one who sent you all the invites. So please do feel free to ask those questions. I'll be very, very happy to answer them. Doctor, any conclusion statements from you?
Yeah. So my concluding word, I think I want to leave behind is hope. Mankind has seen a lot worse diseases. We've seen diseases with road traffic accidents kill more people than this. Yeah. So it is a bad time, but keep hope in the middle. Trust the system. Trust your doctors and your nurses, and let's get back to some degree of keeping our children in a positive frame of mind, because they are surrounded by negative news. You and I, when we were children, never had this much negativity. We never had this much negativity, and we need to dispel that in a very aggressive fashion. So I think, Sunil, you should plan another session for that,
Definitely.
Probably for getting that out. We can have.
Absolutely, Doctor. Thank you so much for that. And I can't agree more on that. It is up to all of us on how do we determine our actions. There's a lot of information floating around. Don't go by information and speculate the fake fear around us. Be an asset to the society. That's what people need to do. So apart from doctors, there is nobody else to authenticate. Somebody out of their experience, they can never be a doctor. So get the information from authentic sources. Make sure that's knowledge, it's not speculation, so that you are kind of confident enough and happy enough to take care of your children. I think that's the way it comes home. Everything you bring in, and if you just dump it at home, I think it's not going to happen. This is one such attempt to bring such doctors to you who actually seen this real time. And thank you so much, doctor, for your time. Always been a huge fan, much before you become national figure, but really love your work. Thank you so much for all the nice knowledge and wisdom shared. So we'll certainly plan another session. And thank you so much. And thanks all the parents for taking some time out. Hope if some parents get benefited out of this, we'll be super happy with this.
Yeah.
Thank you. Thank you so much. Thank you.